So let's talk about you. I invited you on the show because I saw your Instagram post or your Instagram story where you shared your COBRA premium, and it was insane. Do you want to tell us about that?
Sure. Yeah, I was laid off from my job in January 2025, and I got on Cobra pretty quickly. And the first thing I'll say about this is that there's an argument of, okay, why don't you just do an ACA plan? But as I briefly mentioned before, I if I do an ACA plan, I need specialty medication covered, and I'll likely get a worse plan for paying more in order to still get my specialty medication. So the best route I could go is Cobra in order to keep my specialty medication, keep the good plan that I had from the job. So my Cobra premium, coming out of that job, coming out of the layoff, is 1,096 a month. That's as an individual. $1,096 a month as an individual. I've been paying that since the layoff, and I got a notice in the mail that two things happened. One is the administrator of the Consolidated Omnibus Reconciliation Act. The administrator of COBRA is changing. It's changing from one company to another company, and the other company is some vague name that goes under the name just billing services, and they're very hard to track down. So that's its own strange part of all this. But I read it and it said the premiums increase for 2026. Okay, so it's $1,096 for 2025. 2026, now with medical, vision, and dental, it is now $1,500, $1,507.34 every single month premium.
Oh,
That's
God.
so 1507.34. Medical alone is 1439 a month premium. So this is premium once a month. So that means per year, that's $18,000 a year plus in just premiums alone. That has nothing to do with deductible or out of pocket maximum. That's just premiums. That's just to get the insurance. And there's not much breathing room because, as I said, ACA, especially now with the subsidies, it's pointless to go on the ACA. And then maybe there's an argument of get Medicaid. Well, no, that's an issue with specialty medication as well. And there's an income limit there. Uh, and so it's Medicaid, ACA, or no insurance, which, as someone, especially with a chronic illness, having no insurance is a very, very bad idea. And I could pay 18,000 in premiums for the year, or I can risk no insurance but take a huge risk in maybe paying a $80,000 emergency hospital bill if I go to the hospital with a bowel obstruction. So
So
yes.
did they explain or offer any explanation for why it's going up? That's like 50% almost.
That's a really good question. That's an excellent question. And I all I read, and I have all the sheets here. I'm not going to read all the sheets, but all they say in the sheets is the main thing says uh, it's essentially what's going to happen. It's Cobra premium payments when they're due, when they're due, and what's going to happen with your premium. There's no why. There's sort of how is this going to happen, how, what, and when, but there's no why, and why is a great question. And if I immediately, even when I called them to just ask about setting this up, I was met with just like defensiveness um and just a clear like not wanting to be on the phone too long from their end. It's there's really not it's yeah, and but it's a great question because I could ask why. I could say, why is this increasing? They'll very likely say, well, this is just this is what the plan is for the administrator and the company. This is just what the cost is, and this is what the plan. Like they'll repeat, this is what it is, as opposed to saying like, well, the real reason is because we want more profits, we want more money coming in. Um,
So there is an article from this organization called KFF. It's a nonprofit focused on health policy.
is that the
And
Kaiser Family Foundation?
yes,
Okay, yeah, they're
you're
good.
familiar?
Yes, yeah, to some extent, yeah.
They said that just in the ACA marketplace, insurers are proposing to raise their rates by a median of 18%,
Hmm.
fueled by rising healthcare costs and the expiration of the enhanced premium tax credits. They are proposing the largest rate increase in 2026 since 2018, which
Mhm.
is the last time uncertainty over federal policy changes contributed to sharp premium increases. So it seems like some of this might have something to do with rising healthcare costs and some with just them not being sure what's going to happen with these premium subsidies.
Yeah,
Uh, So, I mean, this seems like extortion, honestly. Like,
it does, and that's an interesting thing you bring up too, because it's like from the insurance company's perspective, it's like, well, what are we going to do? We still need to make money too. What do you expect us to do? And it's like, yeah, you're right. You can do this. I technically you're allowed to do this, but it just it's a reminder about like, oh right, uh I was thinking about this a lot because I had a discussion once with somebody about who was arguing for why CEOs make as much as they do, and his argument was, well, that's what the market demands, that's what the market dictates, and it's like a free market system, and that's what it dictates, and that's just what it is. And it's like he was sort of saying, like, take the emotion out. This is just what the market is. And I get that that's probably the argument here too. Is like this is what the market is. The insurance companies need to do this, and that's just what it's like. Okay, but like I thought, like collectively as a civilization, maybe, or as a country, maybe we would just try and look out for each other to some extent. But a compassion is kind of taken out of the picture. Not kind
yeah.
of. It is taken out of the picture. So, um, or an understanding that you're gonna kill people or bankrupt people from doing this by doing this. You know.
Um, yeah, and we'll talk about people's reactions to health insurance companies in a little bit, but I'm curious,
Mhm.
when you got this letter, do you open up the mail, you get this letter, what was your first reaction?
I was like, okay, yep. Honestly, I wasn't that shocked. It hit me because I'm like, okay, that's $400 extra, and I'm currently technically unemployed. I have freelance work, but it's minimal, and uh, but I opened it with like, yep, that's what I expect. Like I'm not shocked by much anymore. I mean, if I opened that and it said $5,000 a month, I would have been shocked. I would have been like, yeah, that tracks, but I would have been shocked. This was like, yep, that's sort of what I figured anyway. Um, yeah, it wasn't, it's crazy, but it wasn't a crazy surprise.
How much of your life do you feel is determined by your health insurance situation?
Most of it, honestly, I think, I most of it because I not only need health insurance, I need good health insurance. I mean, we all need good health insurance, but I'm 34. There are people my age who probably cannot have health insurance and like go the year and be fine without ever even maybe never go to the doctor. I need to go to the doctor. I need to get probably at least a colonoscopy a year. Um, yeah, I need an MRI. I need to check in on where my Crohn's is, and my specialty medication. I take two immunosuppressants, Skyrizi and Rinvoq, and without insurance, those medications, you can look them up, are obscenely priced.
Is another
This is,
issue altogether.
yeah, that's another. You're right. That's another issue altogether because and that becomes a war between the drug makers and then the health insurance companies who yell at each other and be like, you're the villain. No, you're the villain. And it's like, okay, well, we're all just getting screwed while you guys are yelling at each other. So to answer your question, it's everything. I mean, health insurance at this point is everything, and it's essentially life or death. And uh, yeah, and this country seems to be pushing people out, and being like, uh, go find somewhere else to go. Seems like, feels like that at
Yeah.
least.
Well, I'm sorry that you have to deal with this. This is it's absurd. And
Thank, thank you. Yeah, and this is not even meant to be me complaining as much as just like this is just crazy. Like this is just like I'm not even seeking pity or any. It's like um, having friends also in the same boat. It's just like, and also knowing like we're all kind of on the same road together. That this country does not look out for even people our ages, but also just elderly. As you get older and older, you think this country cares about when you're 80 years old, unless you're wealthy. Um, so it's making me envision what this road actually looks like in getting old in this country, and if that's worth it.
yeah, which is another topic I discussed in my first
Yes,
episode is the American
yes,
dream.
yes, that's right.
Well,
I do. Yeah.
it seems like across generations, one thing people can agree on is that our healthcare system sucks, that the health insurance
Mhm.
system is not great. we talked about the ACA, and you mentioned that you had a friend who asked what Obama ever did,
Mhm.
and the ACA is not perfect. There was more that they wanted for that plan. They actually, I believe he actually wanted universal health care,
There's a
but
public option that was I believe Joe Lieberman was the one that put the final nail in the coffin for a public option not happening. So you're right. Yeah, there was potential for that.
thanks, Joe. It's fucking great.
Yeah.
Um,
Hmm.
I'm grateful for things like what we mentioned, that being able to be on your parents' insurance till you're 26. I didn't get to benefit from that, but that's fine. I'm not one to be like, well, I didn't get to have it, so nobody should. But I had a friend who got into a bad car accident many years ago. She was sitting in her car, like paying bills or something, and someone hit her. And they were going really fast because it turns out the person who was driving had like a seizure. And
Oh,
she was in the hospital for months.
uh,
Like, she nearly died. She had to have all this, like, reconstructive surgery done, repaired her organs, all this stuff. And at the time, this is pre-ACA, pre-Obamacare, there were lifetime maximums on insurance, and she hit the maximum because of all of these treatments that she had to have, and was therefore uninsurable after that. It was and then talking about
wow.
pre-existing conditions, which is now covered under the ACA, she also was uninsurable because of the fact that she now had these pre-existing conditions from being in this car accident and having all these things that she had to have done. So, when I think about people like her who've had to go through such horrific things and hit up against the wall with these ridiculous rules, I'm grateful that we have what we have and we need more. And what we should not be talking about is taking it away. We should be talking about how we can make it more robust and make it more affordable for other people.
I wasn't even aware of a lifetime maximum because I wasn't in the system at that time, so I wasn't aware of that. And what I mean, I'm so sorry for your friend, and I hope they're doing okay now. Uh, but that's honestly what this makes me think of. That story is in general is this idea of you don't know if you don't know what it's like, what it was like before. I mean, we could even talk about what is it like now and how can we make it better. But if you don't know what it's like, what was like before, it's like there has been progress, as you're saying, it has gotten better. But I think Bernie Sanders put it as like they just keep tinkering with it as opposed to really doing an overhaul. It's just kind of like it's like a bunch of holes, and you're just like, let's plug this one and let's plug this one temporarily and plug this. Like you have to really redo the whole thing, which is not easy. But it also makes me think of, and this is just a side note of like the people who don't want to get vaccinated for measles. And it's like, well, do you know, or do you know what life was like when people did get measles? Were you aware of what that looked like and what the benefits of vaccines were to that? And if you don't, it's hard to advocate for it because you don't really know the damage it can do. And to what you're saying, like the lifetime maximum is I had no idea that existed, and that's crazy.
Yeah, it's nuts. And the other thing with insurance is it's not just patients who have issues with it, it's also doctors.
Yes,
Like,
yes,
you and I have talked about having mental health professionals who don't take insurance.
yeah.
And my therapist, who I've been seeing for years, told me that I'm her last patient that she accepts insurance for. And as of January 1st, she just cannot deal with that anymore. So she has cut ties with them. And if I want to keep seeing her, I'm going to have to pay $300 a session
Hmm.
as opposed to like a tenth of that with a copay. So I'm like, this is just another way that the health insurance industry is screwing us over because
Mhm.
my therapist doesn't want to deal with them because one, they're not paying her enough. They don't raise the rates often enough. It takes forever for her to get in touch with someone when she has questions about billing and
Mm.
invoicing.
Yep.
And then they make her jump through hoops just to get reimbursed for things. So I'm not a fan.
Yeah.
I want to play a video from a doctor who shares his feelings about the situation.
Hey man, how's it going? Well, I was supposed to do surgery today, but apparently I'm out of network, so the patient had to cancel. Out of network? What does that mean? It just means insurance won't pay for the patient to come see me for their health care. Oh, I didn't know you worked for the insurance company. What? I'm in private practice. I don't work for the insurance company. You sure? Of course I'm sure. So when you see a patient, you send a bill to the insurance company, right? Yeah. And then the insurance company will pay you for your services. Yeah, that's right. Well, who decides how much you get paid? Well, you have to sign a contract with the insurance company. Well, what happens if you don't sign the contract? You don't get paid. Huh. So you do work, and the insurance company pays you for that work, and they pay you whatever amount they decide they want to pay you for the work you're doing. Yeah. I don't know. It kind of sounds like you're working for the insurance company.
Yep. Yep.
And that's a
I
doctor.
I recently met one of my brother-in-law's friends who's an attorney for providers who are suing their lawsuits with health insurance companies. So thankfully he's on the side of the providers, and because he was explaining that to me, essentially that these doctors will bill the insurance, and the insurance will be like, well, we're just not going to pay that. And it's like, okay, and they're like, go ahead, sue us, because the giant Weill Cornell, Mount Sinai, they can be like, all right, we're going to fight you. We'll go up against you, United Health. But if you're private practice as a provider, good luck going up just you versus a giant health company. It's scary, and I think, yeah, it's hard as a patient to see the doctor's perspective too, because you're so worried about your own. But it's like we are kind of in this together to some extent. And I do I'm starting to understand why a lot of doctors don't take insurance. It's not out of trying to screw the patient. It's trying to also just save themselves from a nightmare.
Yeah, so I take antidepressants because
Yeah. Same.
depression, and also this society we live in does not help. Um,
I agree.
and my psychiatrist, her initial intake appointment is $650. Yes. And every appointment, and I don't see her like that often. I see her maybe like once every couple of months, is $375. And once I meet my deductible, I'm reimbursed like 60% of that. But still like a lot out of pocket. And I don't fault her for not taking insurance.
Mhm.
But she's a really good doctor, and it's been worth having to pay that, because I get really good care. And she's not limited by, well, the insurance company will only allow me to see you for 15, 20 minutes. Like, I have a full 30-minute appointment with her when I
Hmm.
meet with her, and she's like engaged.
That's great.
She doesn't
She's
have to worry
actually
about,
good.
yeah, she doesn't have to worry about billing and paperwork. I'm the one that, submits the claim form. So it's not perfect, but in some ways there are upsides to it for
Mhm.
patient and doctor.